Welcome. I'm Dr. Malia Jensen. Welcome to Dr. J's Prescription for Health. This is Sunday Live, where you have the ability to ask medical questions. Again, this is for information purposes only. This is not medical advice. I am not your doctor, and you are not my patients. We are live right now on Instagram, and we are live on YouTube. And it looks like people are starting to join in here. And I really appreciate it that you're here today. It tells me that you are wanting to learn about your health and to take action that maybe action that your personal doctor has not done. So today we're going to talk about a question that got brought up. Good morning, Dean. Yesterday at the very end, I'm waiting for everybody to join in on YouTube, but we are going to talk about uric acid this morning. So hopefully the individual, good morning, Lucy. You are, looks like the only one there starting out on YouTube, but we're waiting for Lucy. Remind me, is it Cheesehead that asked the question about uric acid and gout? And then there was another one who chimed in on oxalates, and we can maybe wrap that up into one big giant portfolio here. Just a little bit. There it is. Well, she said, was that you? Okay, yes, it was. Okay. All right. So thanks for being here and thanks for your question. It got me to look up stuff and I enjoy that. So yeah, I do appreciate and we're gonna take it really slow. Eric, okay. Eric, you might need to remind me. I figured you're probably in Wisconsin since you're called Cheesehead. So, but yeah, I'll try to remember. You might need to remind me, okay, Eric? And sometimes people don't like to give me their name, and I like to say their handle. Some people have their handle as their name. It just depends. So if Cheesehead or Eric, if I'm not specifically talking or highlighting exactly what you're wanting to know, ask me a question. But for right now, let me talk just a little bit and then you guys can chime in. It is a bit complicated and maybe I'm making it complicated and I'm not sure. Okay, our blood pH. How about let's start there. Our blood has a certain pH. And if you guys remember the pH, 7.0 is neutral. Above 7.0 is alkaline and below 7.0 is acidic. By the way, you guys, thank you so much for yesterday. Thank you. The best 2 hours of my whole day yesterday was spending time with you for my birthday. So just so you know, I just want to go ahead and thank you guys right now. All right. So we talk about pH. A 7 is neutral, above 7 is alkaline, below 7 is acidic. Our body maintains a very tight control. This is it, between 7.35 and 7.45. We are alkaline in our blood for the most part. At that 7.35, 7.45 range of blood pH, uric acid stays dissolved in the blood. It doesn't crystallize. It stays dissolved. Okay. If the uric acid goes over 6.8, the blood becomes supersaturated with uric acid. Okay. That's 6.8. A lot of doctors will wait till 7. So Eric's was over 12. So we're going to talk about that. Okay. Because Eric, I can't remember what diet you're on, but I'm going to talk about maybe 3 different diets. Okay. Once your blood is supersaturated, the soluble uric acid becomes something known as MSU. And I think about Michigan State University, monosodium urate. Okay. The crystals drop out of solution and they deposit in areas where the blood flow is maybe a little lower and where it's colder. So your big toe, for instance, that could be. So when uric acid crystallizes, it'll go to a cooler area. There's a difference between blood pH tightly controlled at 7.35 to 7.45 and urine pH. It's different. Urine pH optimal is between 6.5 and 7. So your urine is going to be a little more acidic and your blood is going to be a tiny bit alkaline. Okay? Things that make urine urine less, or let's see, more acidic. If we get a urine pH of less than 6, remember 6.5 to 7 is optimal. So if you guys go get your urine at your doctor's office and they do a dipstick and you see a pH and it's 5 point something, then that's really acidic when we want 6.5 to 7. So you have to ask yourself, why is your urine acidic? Muscle meat. Yes, muscle meat. Eating muscle meat can lower the pH of your urine below 6. If you're dehydrated, you can lower your urine pH below 6. If you have insulin resistance, you can lower your urine pH less than 6. Those are just 3 examples, and I say that because I was trying to maybe talk about a heavy kind of a carnivore, or yep, a heavy carnivore diet, or like Cheesehead says, Eric says, a crapola diet, which is the standard American diet, which causes insulin resistance, or if you're simply just dehydrated. Those are fairly common scenarios, okay? Urine pH fluctuates wildly depending on what we eat. So if we just get done eating muscle meat, it could go down. If we got done eating something that was alkaline, it could spike high. So it's the urine pH can wildly fluctuate, but our blood pH does not. Okay. Uric acid crystals do not cause gout unless there is some sort of inflammation. Eric, joint pain does not start just because your uric acid level was 12. Okay. There has to be an inciting event. Something had to have occurred that can cause that. Let me give you an example. Could you have eaten a whole bunch of steak and butter? Yes. Could you have eaten a whole bunch of plant oxalates? Yes. So if somebody goes and eats a bunch of plants, all plants have toxins in them, anti-nutrients. Plants do not want to die. Plants want to survive, so they have natural toxins. And most animals, except us, know not to eat certain plants. Certain animals eat certain plants, like a, think, is it Lala? Thank you. Lala Lean sent a flower. Thank you for that super sticker. I appreciate it. People eating, um, yep, fruit is a plant. And that has to do with fructose. And we'll get to that, Lucy, but good question. So that's why I'm taking this very slow. And I want you to think about, what's going on. Eric, yes, being on hydrochlorothiazide, being a water pill helped you push out urine. And now that could have over dehydrated you, then increased your uric acid, okay, in the urine. Okay. I don't know what your blood, you're saying that your blood uric acid was. 12, and a normal or optimal is below 6.8. So you went nearly double, right? 6.8 is pretty much the cutoff. Whereas many doctors will not read it high until it's 7. It just depends on the doctor. So let's get back to what we consume. People who eat a lot of plants that are uncooked, they're eating raw plants. They're getting anti-nutrients. Those anti-nutrients are oxalates and phytates. Oxalates and are high in things like spinach, almonds, kale, rhubarb, all of these things. Okay. Um, Lucy, do you want to take care of that one for me? So if we are consuming a lot of oxalates, the oxalates will crystallize. Okay. Those crystals deposit in the joints. Now you have inflammation. Okay. You have inflammation in the joint, and now uric acid crystals can go and accumulate there. A uric acid level of, say, Eric's 12 or somebody else's 7 does not cause gout on its own. It needs a nidus, some sort of an inflammatory process. Oxalates from plants scrape the inside of the joint. They'll scrape anything. They'll scrape our mouth. And I'll give you an example. When you eat a spinach salad, you know that kind of a film that you get on your teeth? Like when you chew and you kind of rub your teeth sideways, it kind of like squeaks like a chalkboard kind of, or you get this film in your mouth. You guys, your mouth is full of oxalates. And those crystals can actually do micro tears in your mouth. And that's how bacteria can have a stronghold. So imagine if the oxalates are doing the damage in the mouth the minute we eat them, it scrapes our esophagus, scrapes in our stomach, scrapes in our intestines. If it gets into our bloodstream, it scrapes the arteries. If it gets in our joints, it scrapes on the joints. And that leaves a joint, and I don't know how deep I want to get into this, but I did take this note, okay? When oxalates scrape that joint, say it's your big toe or your knee or your ankle, okay? Usually the furthest away is cooler, so it's going to go to a cool joint. It activates something called NLRP3. It's an inflammasome and an inflammatory particle, which floods the joints, and then that NLRP3 inflammasome triggers cytokines, and cytokines are inflammatory, like interleukin, IL-1 beta, 1 beta, interleukin dash 1 beta. Okay, that is an inflammatory cytokine. You can see that oxalates plus uric acid can cause an explosive gout. Okay, that's not a good thing. Let's talk about now why uric acid even gets high. Why did Eric have high uric acid? Could he have just eaten a spinach salad, ate some sorrel soup with high oxalates and ended up with this high uric acid just for the time being, and then it went haywire? Yes. Could he have eaten an additional spinach salad with high oxalates, caused some joint inflammation? Uric acid went sky high. Yes. Why is it that there's two main reasons why our uric acid builds up? Number one, and the most important problem, is 90% of gout, or let's just say uric acid built up, let's just say uric acid built up, is from the kidneys' inability to excrete uric acid. 90% of the time, it's an excretion problem. 10% of the time, it's our body making or we're eating too many purines. Okay. 10% of the time. That's kind of why carnivores don't get build up of uric acid because of what they're eating. It's because of how they can't excrete it, or anybody can't excrete it. 90% of the time, if a person, I'm going to talk about three different situations here. If a person transitions from a standard American diet to a carnivore or a ketogenic diet, they can get an explosion of uric acid. It's because of this first time switching to carnivore. The liver floods the body with ketones like BHB, beta hydroxy butyrate. Remember, the reason we go ketogenic is to start making ketones. We make ketones from fatty acids, from our fat. So if we don't have sugar coming in, that means insulin is low, and then our body starts breaking down fatty acids and we make ketones. Those ketones, when we first go haywire or we go all in on a carnivore diet, the ketones start going up, and it's usually within the first 7 days. Okay. When that happens, our body, kidneys, wants to take care of the ketones before it wants to take care of the uric acid from the purines. Make sense? So if 90% of uric acid is excreted in the kidneys and the kidneys are busy taking care of the ketones, you can see that uric acid takes the back burner and levels can go sky high. And some people transitioning from a crapola diet to a carnivore diet or a ketogenic diet, like Eric said, maybe the paleo diet, just that simple transition and ketone production can throw our body into haywire. And the natural tendency is for the person to give up and say, this diet is not for me. I got sick. And it's all the fault of the diet. Not really. It's just that your natural body is taking care of things. Okay. Your body is normally trying to take care of the ketones because you went into more a ketogenic diet than a crapola diet. If the person has been carnivore for a long time, and I have a lot of carnivore and ketogenic people listening. That's why I'm talking about these two first. Okay. If a carnivore, picture this scenario, the carnivore goes carnivore because they know that carbs increase blood sugar, increase insulin, and lead to metabolic syndrome, metabolic problems, high insulin, high blood pressure, heart disease, on and on and on. So they know I'm all in, doc. I'm all in carnivore. Well, the real definition of carnivore is low carbs, right? Okay, I'm gonna take care of that one. Lucy, thank you. Um, the real definition of carnivore is low carb, actually zero carb. Okay. So it's going to be purely a ketogenic diet. Carnivores are supposed to, just like all animals, we are an animal. Most animals eat nose to tail. If you eat nose to tail, you won't have any deficiencies starting up. You won't have lack of vitamins and minerals. It is what it is. Okay. Initially, if you go from a crapola diet to a carnivore diet, you will feel amazing until you don't. Why? Because you're lacking something. Why? Because you only eat certain foods. If you are carnivore, you're feeling great. please be cautious, okay? If you're only eating beef, muscle meat, and some eggs, maybe a little bit of cream, okay? You risk taking in a ton of methionine, all right? Methionine is very high in muscle meats and even in eggs. Likewise, in muscle meats and eggs is low amounts of glycine. If a person is eating a massive amount of methionine, say somebody like Dr. J, who's eating a pound of ground beef every day, eating 6, 7 eggs a day, somebody like me would be consuming a massive amount of methionine and basically zero glycine if I'm not eating nose to tail or taking in any type of collagen or bone broth or eating the skin or nibbling on bones, something like that. If somebody is just eating muscle meat and eggs and they're feeling like, oh my gosh, I feel so amazing. I have energy. I'm sleeping. My workouts are amazing. Everything is amazing. I understand because you went from usually a crapola diet to something that is pure whole foods. You're going to feel amazing. Similarly, a person who was eating a crapola diet and went vegan will feel amazing, amazing because they stopped the crapola diet and they went to a whole food diet. Now, most of you know that plant-based diets lack carnitine, carnosine, creatine, B12, all of these things. And a good, smart vegan will know these things and supplement with them. On the other hand, carnivores don't think that they can be deficient in things. All right. And they can be. They can be deficient in glycine if they're only eating muscle meat, which is full of methionine. You need glycine to neutralize methionine. Church Piper says, I feel amazing every time I eat beef liver. If everybody were to eat organ meats and drink some bone broth, the carnivores otherwise, would not have this overload of methionine and no glycine. Okay. There is no glycine in that meal of hamburger or steak, muscle meat, and eggs. There's no glycine. Zero. Over time, you build up methionine. Over time, that methionine builds up homocysteine. That's why I'm always harping on you guys to get a homocysteine level. Why? Because homocysteine is like scraping the lining of your arteries. That causes an injury. An injury causes a blood clot, and then bam, 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 on and on that we talked about yesterday. So high methionine that is not opposed by glycine causes homocysteine to go up. High homocysteine causes oxidative stress, inflammation, scrapes up the artery lining, even in the kidney arteries. It's like sandpaper. So the kidneys lose structural ability to filter, you guessed it, uric acid. This is how I'm circling back to how 90% of uric acid problems are a kidney excretion. And it can happen in a plant-based person or a carnivore who's mainly eating muscle meat. Now, let's move on to the um, less than 10 Schiff, less than 10 homocysteine level. We do not want it over 10. Okay. Let's talk about non-carnivores. Let's just talk about the vast majority of people who have gout, high uric acid. They're just eating whatever. They're non-carnivores, they're vegans. They're just standard crapola diet, standard American diet. These people, 75% of them, guess what? They have insulin resistance. What does insulin do to affect uric acid? Well, high insulin stimulates a receptor called urate 1, URAT1. It physically grabs uric acid and filters it back into the bloodstream. High insulin increases urate receptor that grabs a hold of uric acid, brings it back into the bloodstream. Instead of the kidneys going out, it goes back into the bloodstream and gets recirculated. All because you have insulin resistance. Remember, uric acid is very inflammatory. Remember, hyperinsulinemia is very inflammatory. You can see where high uric acid and high insulin can lead to a heart attack, right? Inflammatory process, injury to the lining of the arteries, bam, a blood clot forms. Once uric acid builds up, it in the blood, like Eric with his 12, it damages the endothelial cells. And those endothelial cells are responsible for making nitric oxide. If you have low nitric oxide, your arteries don't vasodilate, they actually constrict. So that is a problem. And this is hard on your heart because if you have vasoconstricted, narrowed arteries, your heart has to pump harder. Okay. Your heart has to pump harder against that pressure. Remember where injury and plaque forms most commonly is in areas of high turbulence, high blood pressure. So low nitric oxide, high constriction, high blood pressure, turbulence, injury, blood clot, bam. Thank you, Pisces, for the birthday wishes. I appreciate that. I appreciate that, Dina. I appreciate it a lot. So let's review the things that could be causing artery damage that we just talked about. We talked about oxalates. We talked about uric acid. We talked about homocysteine. All of those can cause micro tears in arteries. And then that creates that sticky environment for your circulating LDLs, especially those small, dense LDLs. All right. That's insulin resistance. That's a general standard American diet. And let's say that they eat a standard American diet and they drink alcohol. The alcohol, and this is where Lucy's question comes in about fruit. Fructose and alcohol act exactly the same way. They go to the liver and it actually drives oxidation and it drives not only under excretion of uric acid, but over production. When I want to see how much fruit people have been eating, I can't really test how much fruit they're eating. Thank you, AMV. I appreciate that. I can't really test it by getting like a fructose level. I can get a glucose level. I can't really get a fructose level, but you know what I can get? A uric acid level. If the uric acid is high, fructose is high. It's in a 1-to-1 ratio. Fructose and uric acid is in a 1-to-1 ratio. So I get uric acid levels on people. And if I see a 12, I'm going to go, hey, Eric, how much fruit are you eating? Oh, gosh, I love fruit. I eat it every day. I eat some kiwi and some strawberries. I'm eating blueberries. I eat a banana. I love fruit. I just eat it. I said, oh, I see. Yes, you have high uric acid. And then in there, besides the fruit, they're having some salad of spinach. They got high oxalates. They're causing some damage there. They're getting some overproduction of uric, or little bit of overproduction of uric. Remember, 10% is overproduction. So you can see how all of this kind of compounds. All right. Alcohol. This is a curious one. Alcohol, when the liver breaks down alcohol, it generates lactic acid. The kidneys kind of look at lactic acid as an emergency. So you've likely heard this, that if you drink alcohol, your liver is going to take care of that alcohol first before it does anything. It's an emergency toxin. Same with uric acid. Alcohol causes the kidneys to try to remove that lactic acid very, very quickly, faster than even uric acid. So if people are drinking alcohol all the time, their uric acid can build up because their kidneys are taking care of the lactic acid from the alcohol. So those three scenarios of a general diet would be insulin resistance, alcohol, and maybe genetics. And maybe this is where Eric falls in, that you could have genetically inability to excrete the uric acid. You have a broken exit. The exit door is broken, genetically speaking. It's pretty rare, but it is there. I wanted to mention it. I'm going to pause right now and see if you guys have any questions. Homocysteine versus C-reactive protein in blood levels. C-reactive protein, high sensitive C-reactive protein, and an inflammatory marker, Marion, we want that less than 1. Homocysteine level, we want less than 10. Homocysteine is inflammation. Flow state, thank you. Thank you for that. Haben, thank you for that super sticker. I appreciate it. Okay, so homocysteine is inflammatory only because it's like sandpaper to our arteries. C-reactive protein is an inflammatory marker measuring inflammation, but it doesn't just measure homocysteine. It could be measuring insulin. It could be measuring a pimple on your butt. Anything that is highly inflammatory can raise C-reactive protein. When we get a high sensitive CRP, HS-CRP, it's highly sensitive for the heart. It's more sensitive for heart artery inflammation. And yes, doctors like to get an HS-CRP because CRP is less specific. Like I said, the pimple on your butt could probably cause the problem of high CRP. So that is, in a nutshell, that answers that question. I hope I answered your question, Marion. Let me make sure. Okay. All right. So let's move over. 1910 says, thank you for the gout explanation. You're very welcome. Make sure I didn't miss any. Did Angel have a question or no? No, looks like not. Okay, I did answer Marion's question, so good. All right, next question. Okay, AMV says, do you happen to have a decent standard diet plan you can share or suggest that covers most of the necessary nutrients or minerals and vitamins? I can, but I'm going to be a bit biased. Before I get into that question, AMV, should we talk about the Erics of the world with the high uric acid? How could we possibly help Eric with a 12 correct that? Okay. One, we could hydrate Eric because Eric is on hydrochlorothiazide, which um, is a thiazide diuretic. So Eric was put on on a thiazide diuretic, maybe for blood pressure, maybe for localized edema. I'm not sure, but made him dehydrated. So you could hydrate Eric. Okay. We also could give freshly squeezed lemon juice in water because this will alkalize the urine to the pH that we need it. Remember, optimal urine pH is 6.5 to 7. Just simply squeezing lemon juice in our water can do that. But if you don't eat fruit, here's another way you could do it. You could use potassium citrate. Potassium citrate will alkalize urine. When we have an alkaline pH 7 or above, uric acid becomes 10 times more soluble. We want it soluble. We do not want it crystallizing. However, if we get too alkaline over 7.5, this can lead to calcium phosphate stones. Calcium phosphate stones. This is how tight our urine needs to be, between 6 and 7. But if you have high uric acid, we got to make it only a tiny bit alkaline, no higher than 7.5. And we will help get the kidneys to excrete. It makes it more soluble, not crystallized, and get it out of our urine. Magnesium malate can be used to help with high uric acid. When magnesium is low, kidneys hold on to waste products. Uric acid is a waste. All right. This is complicated, you guys. This is really complicated, but I'm trying to give you a protocol to bring down a uric acid level that's very high and inflammatory without taking any medications. Okay? Potassium citrate, fresh squeezed lemon, magnesium malate. You could take bicarb. You could do a tiny pinch of baking soda, baking powder, baking soda in your water, and you can alkalize your urine just enough. But again, you can't go overboard. It goes over 7.5, we get kidney stones. Not the most common kidney stones either, because the most common are calcium oxalate stones. We're talking here calcium phosphate stones. Totally different, but still a stone. I think that's the only way we can get rid of the uric acid. I think so. Let me make sure. Now let's go to AMV's question. AMV asks, let me see. Yeah, habanero, I would have to look up TMG for homocysteine, but we already know that if we eat a lot of methionine, our homocysteine is going to go up. And what compounds this is if a person has an MTHFR genetic, they have MTHFR deficiency. They don't have an enzyme or very little. 49% of the population, 49% of the population does not metabolize folic acid into methylated folate. They have MTHFR. If they don't break down folic acid from our food into folate, homocysteine goes up. So not only is an MTHF, it's a double whammy. You have MTHFR and you're only eating methionine foods, high muscle meat. Your homocysteine can skyrocket. You can treat the MTHFR portion by giving B12 and folate. If they're already eating muscle meat, they probably don't need B12 and their B12 level will be fine, but they don't have folate. They don't methylate. So folic acid builds up in their system and becomes toxic. They might not even know that unless they get depressed. A lot of times, or they have a miscarriage. And then doctors like me say, "You've had 3 miscarriages and you have depression? Let's get an MTHFR." And they go, "Oh my gosh, it's positive." The doctor was feeding the pregnant woman full of folic acid. She can't break it down. It was building up in her system. She needed, because she has MTHFR, either heterozygous or homozygous, one gene or 2 genes. You guys, doctors were making mamas have miscarriages. Okay, maybe the first one you can get by with. Oh, I'm sorry to hear that. Number 3, you should have known to check MTHFR. And if you would have said, "Yeah, I'm just so depressed. I've always been depressed," then you really start thinking about it. Okay, so MTHFR, inability to methylate, and you're on a muscle meat diet. Well, high homocysteine, high risk inflammation, injury to the artery linings, blood clots, heart attacks, and strokes. Do you see how all this kind of ties into yesterday's talk? Kind of. So I don't know how TMG fits in, but I would want to know what is causing my homocysteine before I go and just blanket treat. Okay. If there's MTHFR, they probably need methylated folate. If they're only eating muscle meat, then eat nose to tail, or they don't want to eat any bones or drink bone broth or do whatever, get glycine supplement, get magnesium glycinate, get a glycine supplement, get a Paleo Valley collagen bone broth, whatever it is, okay? All of that will help bring back glycine. And glycine helps to neutralize the methionine and get the kidneys to start spilling out the uric acid instead of reabsorbing it. Okay? Glycine, glycine, glycine. If you remember one thing today, remember glycine. Glycine is considered a non-essential amino acid, but it's not really non-essential. It's not non-essential. That means if it's non-essential, it means our body does it, it makes it. And our body does make glycine. I guarantee you it makes it, just not enough. So they call glycine a conditional non-essential amino acid, or it's conditionally essential. What's the condition? Stress, high muscle meat consumption, high uric acid. Then you need even more glycine. By the way, you need glycine in order to make glutathione. You need cysteine to make glutathione. You need glutamate to make glutathione. Why do you need glutathione? It is a master antioxidant. This was not in my notes. This is coming out of my head, but it's all fitting together when AMV is saying what diet will cover everything and I don't have to worry. If you are a carnivore, eat nose to tail, or eat your muscle meat, eat your eggs, get some liver supplement like ancestral supplements or heart and soil. That'll cover your organs. Then get some collagen like Paleo Valley, whatever it's called. It's a powder, collagen powder, whatever. Eat bones, drink broth. Now you have everything you need, AMV. If you eat a vegan diet, you're going to need a whole bunch of supplements. Okay. It is what it is. Over time, these people are going to simply be so deficient because of the oxalates, and most of them are eating these plants raw. That's even worse. At least if you're a vegan, cook everything to boil it 20 minutes. And that will boil out most, not all, but most of the anti-nutrients. Okay? We'll boil out most of them. Is okay. So, AMV. Do people who eat a standard American diet have nutrient deficiencies? Yes. That is why they're obese. They're obese because they are malnourished. I know what you're thinking. How can they be malnourished if they're obese? I think they have a you would say, I think they're doing okay. No, they're not. That's why they keep eating, because they're searching for nutrients. So they keep eating, but their brain tells them to pick the wrong food, the wrong nutrients, the nutrientless foods. There's no nutritional value. They pick those foods. They don't supply the nutrients your body craves. Your body says you're still hungry. You go back and eat. Plus, usually you pick sugar laden foods. Your brain, once the level of sugar goes down in the brain below 6 grams or whatever it is, 5 grams, then it triggers you to look for sugar instead of allowing your liver to either break down glycogen or gluconeogenesis. You go for a quick fix. You pump up your blood sugar and on and on and on. Obese people are malnourished. Obese people are malnourished. They can have high uric acid. Why? Because of insulin resistance. They might drink alcohol. That causes uric acid to build up. They might have a genetic component. Doubt it, but they could. Okay. Let's not, you know, whatever. Okay. So hopefully AMV. I don't know what diet you choose. I'm more animal based. I'm going to choose, if I need to, is eat my muscle meats, drink my bone broth, nibble on the bones. If I can't do that, then you get the Paleo Valley. If I can't stand liver for a period of time, I'm going to get some ancestral supplements or some heart and soil, and I'm going to complete my animal-based diet. If I'm a vegan, I'm going to have to take a creatine, a carnosine, a carnitine, a B12. I might need a zinc supplement. I might need copper. I'll probably need iron because oxalates and phytates, all plants, block the absorption of, I'll just rattle them off. Usually anything with a positive charge: calcium, magnesium, selenium, zinc, copper, iron, B vitamins, oxalates, and phytates block the absorption of those things. Here's something that I failed to mention, and this is good to know. So the person who's eating the vegan diet, say, they are eating they're they feel great, and they might not be vegan. Let's just say they're plant-based, but they'll still eat a little fish, they'll eat meat, but they eat a ton of greens. They eat a ton of almonds. They're the things that have oxalates in them, spinach and kale and rhubarb and all of those things, right? Those oxalates will flood the bloodstream. They can spill into the urine. If a doctor gets a spot urine, they can see oxalate crystals coming out in the urine. Remember, those oxalate crystals are irritating, scratching the surface. If you eat them, they scratch your mouth. If you're peeing them out, you are hurting your kidney tubules. They get inflamed. In addition, what I just mentioned, those oxalates bind to copper and calcium and magnesium and iron and selenium and zinc. If a person has who is eating all of these plants, one of the things that I want to bring to your attention is copper. Copper is needed for the production of ceruloplasmin by the liver. Ceruloplasmin is what moves iron. So you could build You need iron so you can build hemoglobin and you can build white blood cells. If we drown ourselves in plants, we're actually starving our bone marrow of the copper needed to make blood cells. This can lead to anemia. You're told that your hemoglobin is low, your hematocrit is low, and they'll tell you, take iron. Wrong. You have enough iron. It's the wrong kind. It's non-heme iron. We're talking about a plant-based person here. They are consuming non-heme iron. Non-heme iron is hardly, maybe 3% absorbable. Heme iron from animals is about 30% absorbable. But here's the thing. Back to the oxalates and phytates in the plant-based person. They're going to have one of the things they're going to have that's low is copper. And copper is needed to make ceruloplasmin. And you need ceruloplasmin to have active ferroportin. Ferroportin is like a conveyor belt that takes iron out of the cells and puts it back into the bloodstream where it can be used by blood cells to make hemoglobin that can be used by the blood cells to travel and bring oxygen to our brain and organs. If we take in all of these plants, we don't absorb copper. Copper that's low drives iron and traps it in organs like the liver and the kidneys. Okay? And it's trapped there. If we increase copper, so we give a copper supplement, now they start making ceruloplasmin and ferroportin, and now we can get the iron out of the liver or kidney or wherever it's trapped back into the bloodstream so that iron can be used. Most doctors will say, oh, just take a bunch of vitamin C. Well, that sounds like a smart thing because vitamin C increases the absorption of iron. But guess what? Taking vitamin C increases oxalate production. So you got a plant-based person who they say is anemic. They give them fake synthetic iron in the form of non-heme iron. That's what it is. The only heme iron comes from animals. Non-heme iron comes from plants and synthetic vitamins. So if doctor, being as smart as they are, tells you to take a bunch of vitamin C to increase your absorption of the non-heme iron, then you just increase oxalate production even more in the person who's eating a bunch of oxalates, which worsens your problem. Make sense? Let's turn the tables a little bit. And why does a carnivore or a muscle meat eating person can get the same exact stuff, low copper? Because carnivore eating people have high amounts of zinc. When you have overload of zinc, guess what it competes with? Copper. High zinc, low copper, iron gets gets trapped in tissues, ceruloplasmin goes down, ferroportin goes down, iron stays trapped. You're called iron deficient. Here's your iron. Bad. I'm telling you, it is a nasty sequence. And if we don't know all of these combinations of what we're eating and what they can deplete us of, zinc and copper share the exact same absorption pathway. So somebody like me who's eating a pound of meat and some eggs, I'm getting about 20 milligrams of zinc. Guess how much copper I'm getting in a pound of meat and some eggs? 0.3 milligrams of copper. That is a ratio of 66 to 1. Just trust me. What should our ratio be? What is an optimal zinc to copper ratio? 8 to 1. So if I'm eating a pound of ground beef, eggs, and I'm getting all of this zinc and I'm not getting any copper, my ratio is around a 66 to 1 when it should be an 8 to 1. I've got trapped iron. I got low copper. What are my symptoms? What is the symptoms of somebody with low copper? Sluggishness, so fatigue. They could be cold. Why? Because you need the mitochondria need copper to turn the furnace on. Mitochondria, they make ATP, right? They are furnaces in every cell. So your mitochondria are like furnaces burning. Well, if you don't have copper, your furnaces aren't burning. Your cells are like hibernating. They're not doing anything. Okay? They're not doing a thing. If you add copper back, because you're probably not going to change your diet that's high in zinc, you're just going to replace the copper. Sounds crazy, right? Is there any questions on that? This is deep. That's really deep. What does magnesium malate do? Well, it increases magnesium, right? Malic acid helps to generate ATP. That's what the malate does. So it's part of the energy source for the kidneys. If the kidneys are low on energy, which they are because they're working so hard doing everything else, then they're probably low. It's just one option, Lucy. It's nothing that I studied extensively. I could have gone down so many rabbit holes with this, but the magnesium is probably the main problem. So adding back magnesium does help the kidneys. And again, what if the person is consuming a bunch of calcium products? Now you're going to lower magnesium. There's just so many things. And you guys, I don't want you to get overwhelmed with all of this because our bodies are really, really good at fixing things. Like a person could eat a standard American diet. Honestly, they could live to 90 years old. A carnivore could be thinking that they're living the ultimate health diet. They're eating what they call ancestral, but they're not. They think they're eating ancestral, but they're not because if it was such a thing of your ancestors, they would have eaten head to tail, nose to tail. They didn't they drank the blood for the salt. Okay? They drank the blood, they ate the bones, they ate the skin, and then they would eat the muscle meat. Okay? They would eat the organs. They would eat all of the things. They didn't have the problems. And then I don't know where, well, I do know where, I think I know where, when the vegan diet came, back in the, you know, I was at 1920s, 1930s, when the sanatorium opened up and they gave them certain diets, when the Seventh-day Advents came about and basically their religious beliefs said if you eat animals you'll masturbate and be hypersexual and make babies and do all these things, so they based it on what was thought to be a Christian theology, and it's not Christ-like at all, because if anybody knows Jesus, he wants us to be fruitful and multiply, right? Well, the Seventh-day Adventists did not want that. They wanted the opposite. They didn't want you even thinking about sex. So if they kept you away from eating meat, they thought that you wouldn't get sexual. I mean, this is the crazy thinking, okay? And then I think where the Seventh-day Adventists started really pushing hard is they would say, if you kill an animal, then you are cruel. And so you got all these people who love animals. Trust me, if there is a lover of an animal, it is me. I the the dearness to my heart is an animal. Okay. I might have some special love for some people, but if it's an animal, it's probably across the board love. That's probably why it's easier for me to take care of people because I can disassociate the love of people like I do for animals. And it's much easier to treat a human than it is an animal for an animal lover. Now, according to the Bible, we are apex predators. We are the top. We have dominion over everything in the sky and everything that crawls on the ground. And that includes cows and deer and sheep and lamb and fish and birds and all of it. That's biblical. And you might not agree with me, and that's fine, but it's biblical. I mean, I'm not giving my opinion, I'm giving the Bible opinion. Okay. And so, would I kill the cow? No. I probably would let the cow eat me if there was probably between the two of us at the end. I'm not sure. But he doesn't eat me, he only eats plants. So I would definitely make sure he was well fed. It's tough. I get it. But the fact that if people say I don't want to kill anything, they're still killing a plant. A plant is a life form. And I think other plants talk to other plants, and I think people talk to plants. I think plants probably thrive better in when their owners are talking to them. If you talk to your grass and hug a tree, I think the tree gets our energy. Maybe you think that's crazy stuff, but who knows? Okay. Remy says, my iron is low. What is your iron? Is it your ferritin is low? Remy says, my iron is low. Is it low though? Or is it trapped in your liver or thyroid or kidney or any other tissue? You're taking ferrous sulfate, which is a fake synthetic iron. You're also taking a bunch of vitamin C, which is supposedly going to increase the absorption of it, but it's not because you're asking for any other suggestions. My suggestion is, do you have low iron? Or is it just misplaced? It's in the wrong spot. It's not in your blood. Have you had a copper level checked? Have you had a vitamin A level checked? Have you had a vitamin D level checked? If you had a vitamin D level checked and you had a low vitamin D and then you started taking a bunch of vitamin D, overdosing on vitamin D to get your level up because that's what you've been told to do, then what happens to your vitamin A? Oh, it goes down. And then what does vitamin A do to copper? Oh, it goes down. And what does low copper do? Oh, it lowers ceruloplasmin and traps iron in the liver. And now you have iron stuck in the liver, so it's not measurable in the serum in your blood. So that's why we need to get a ferritin level, a transferrin level, a TIBC, and an iron saturation, a saturation level. You want all of those things. Then you want to check an MCV, and you want to check probably an RDW, which is on a CBC. There, Remy, I don't know what suggestions because I would need to extensively look at your labs and put it all together. But my thing is, you likely don't have iron deficiency. I mean, true iron deficiency, unless you were in a car accident and are bleeding to death, or you just had your period and I measured you on the seventh day of a heavy period. Then you might be a little deficient in iron. That's why I don't promote taking all of these supplements without checking levels, without checking levels. And don't just take haphazardly a whole bunch of vitamin D and not check your vitamin A or your copper level. Don't just take a whole bunch of vitamin C and cause a whole bunch of oxalate production. Habanero says, I've used TMG, I'm guessing, for 10 years because I have MTHFR and it keeps my homocysteine levels down to 5.5. Well, I still want to look it up. Is that okay, habanero? Because I like to learn, but thank you for the information. Church saw a video about ferritin levels and dopamine having an impact on ADHD, attention deficit hyperactivity disorder. So, was it a low ferritin and low dopamine and high end ADHD, or what was church, what was the parameters, okay? Penny says, what about a person with B12 absorption issues? You want to get a methylated form. The methylated form will be more absorbed, okay? Eating red meat has natural forms of B12. Church asks, would that be helped with eating liver and so on? Would what be helped with eating liver and so on? I don't know. Lucy says, I love Paleo Valley bone broth protein. Lucy, question for you. Why do you love it? Do you love it because of the taste? Lucy, are you buying the ones with taste? Or are you buying the pure, no taste, crappy, or, things that the bone that was broken down and it has like this isolate smell to it? Because you can barely mix Paleo Valley bone protein broth, whatever. Okay. It does not mix well. It will clump. It will not go into solution very well. You have to use warm water. So, Lucy, maybe the next time you purchase it without taste, without any chemical additions. Thank you, Habanero. TMG. Thank you. I will look it up because I want to learn more. I got grass-fed gelatin from Further. 1 tablespoon has almost, well, 2.3 grams of casein. So that's a good point here. Okay. So remember that, so say Lucy is the carnivore person. Okay. She's animal based and she's adding all these things. Let's just say that her food is going to give her about 3 grams of glycine. Okay. And she's going to take a scoop of the Paleo Valley, right? Lucy, a scoop. That's going to give you 2 grams of glycine. And then you're going to do the gelatin, from Further. I don't know what that is. Maybe you can send it to me. And now you're going to get another 2. So now you got 3, 2, and 2. You got 7. Okay. In your diet, if you're just eating like the muscle meat, like say you're eating a pound of hamburger and some eggs, you're probably getting 8, 9 grams of methionine. They're still not neutralized. See what I'm saying? You would need 9, if you're getting, say, 8, 9 grams of methionine, you need 8, 9 grams of glycine. So you would maybe need to add some magnesium glycinate. Lucy, do you take magnesium glycinate at night? That might give you another 1 or 2 grams of, now you've neutralized the methionine that was in your muscle meat. Okay. It didn't solve the zinc problem though. So then you need to get copper from your organ meats. Okay. Diet and nutrition is tough, you guys. I get it. It's overwhelming, but I just don't want you to hurt yourself. And it's not like you're gonna, I honestly, I don't think it's something that you're going to die, but I think what's gonna happen is, say you're on this carnivore kick and you feel amazing. I mean amazing, okay? And you just can't really stomach the organ meats and you don't really like sardines for the vitamin A and the D and all of that. You just love the hamburger and eggs. You're like Dr. J. Well, I think eventually you're just not going to feel as great as you used to. It's not that you feel bad. It's just that you're not going to feel great like you used to. And I think it's because some nutrient deficiency. It could be too much zinc from your meat, not and then it lowers your copper because they were competing, or you have too much methionine and not enough glycine, and you got a buildup of homocysteine, and you got a buildup of uric acid, and then you have blockages in your arteries. You get a calcium score, and your calcium score went from 0 to 100. Okay. I don't know if that is the scenario, but I'm just throwing it out there. Yeah, Lucy, obese people are malnourished. I agree. Um, eight eights. Okay, Robert says the book Sapiens helped him understand what we should be eating. Good. So you guys, that's an option is to read that book Sapiens. Thank you, Colin. I appreciate that. You're one of my biggest fans. I appreciate the kudos. Sometimes I need that. But again, you guys, this is a topic I had to really read about. I started reading about it last night and I continued into this morning, just trying to like, how can I make this so simple for not only me to understand, but you guys? So that means I need to explain it in such a way that allows you to get a little bit of grasp. And I think the little bit of grasp that I want you to get from this particular topic this morning is that when we I hate to say this word, restrict our food nutrient wise, we can end up with problems. Not always, but you guys, it's a possibility, okay? And it throws off pH, it throws off vitamins and minerals, it throws off proteins, it throws off everything. It throws off our iron. And if we're not educating ourselves, we won't know until it's too late. And honestly, it can be reversed. So if you came in saying, Dr. Jensen, my hair's falling out, I'm kind of tired, and I am freezing. What is my first thought? I think thyroid. So I check your thyroid, right? I check your thyroid, and your TSH is below 2, your T3 is 3.4, your free T4 is 1.5, your reverse T3 is 5, your TG is 1, and your TPO is 0. Do you have a thyroid problem? No. So what is kind of making you sluggish? Your hair fall out and you're cold to the bone all the time. Well, what are you eating? Dr. Jensen, I'm eating carnivore, baby. I eat carnivore. And I said, oh, great. Awesome. And doctor, I got rid of my diabetes. I'm off blood pressure pills. I don't have cholesterol problems. I feel great, except for your cold. Your hair's falling out or thinning. It's thinning. And you're just a little sluggish. I'd say, mm, ma'am, sir, we should check your copper level. Why? Well, you just said that you were eating a bunch of meat. Yeah, but doesn't that have copper? Mm, let's check. What else are you eating? Well, nothing. I just eat the meat. That's what Sean Baker does. He just eats steak. Well, does Sean Baker just eat steak? I don't know. After this amount of years, I'm not going to speculate. We should probably check his vitamins and minerals. His body might be doing just fine. I don't know. Lucy, in hospital, low blood pressure, 107 over 84. That's not low. Lucy, what's wrong with that? Are you dizzy or something? What eat breakfast? Eggs and bacon. Sugar, raisins, eggs. Thanks. Gonna give meds gonna take meds for to raise the blood pressure? I don't get it. Why would you take a medicine to raise your blood pressure? Why don't you just increase your salt? Good salt. Jante, I don't have any requests that go into that I want to join videos. Those are only for if I have scheduled a special guest. Um, AMV says, thank you so much, especially the tip to cook raw vegetables. Yeah, never ever eat raw vegetables from here on out. Cook them 20 minutes. Get rid of the anti-nutrients. So dangerous, you guys. So much information. Thank you so much. You're brilliant. Not really. I had to look everything up. But I can help explain it. Maybe because if I keep studying over and over and over again, all the dots start connecting, okay? They start connecting. And right now, maybe none of your dots are connecting, and that's fine. Okay. Yeah, 7 Marla, that ferritin is low, but I need to know the other things. Okay. Mary has a low ferritin at 19, but has normal iron. Don't know what to do. Mary, get a ceruloplasmin level. Get a cerulo, plasmin, plasmin. Get a ceruloplasmin level. Get a copper level. Get a vitamin A level and a vitamin D level. And then if you want, get a zinc and a selenium level and a magnesium level. Did I say that? 7 Marla has not. Marla has not eaten red meat in 30 years. Hmm. Why? It Low copper can be associated with aortic aneurysms. That is expansion of the tissue. Could you have a genetic predisposition to an aneurysm? Yes. But any weakening of the walls, any weakening of the inner lining of the arteries, we have a problem. Inflammation, inflammation. Okay. But I would have to look up the mechanism of action, MOA. I call it the MOA of copper and aneurysms. Okay. Biggie says, I'm morbidly obese. I'm diabetic. I have fatty liver disease. I have high cholesterol. Well, I doubt you have high cholesterol. I bet you have high triglycerides, low HDL, which is called dyslipidemia. Has pancreatitis from all of the triglycerides and chronic pain and bladder issues. Biggie, um, I know that you know the answer on what to do. Sharon is insulin resistant. Reverse it. How do you reverse insulin resistant? What causes insulin resistance? Carbs. Have I written a book? Asked Church Piper, and I have not. Never thought about it. Lucy says, great lesson on uric acid. Have beef liver and you fix your copper problem. Yes. Yep. And or a copper supplement. So there's one made by Thorn, Thorn. It's a good copper supplement. Okay. You're supposed to take copper on an empty stomach, but it can cause nausea. But Thorn has like you said, you could add all of your organ meats. You could take the ancestral blend or the heart and soil, or simply eat kidneys and heart and liver. Eat nose to tail, yes. But if you aren't going to do that and you need to eat the organs in a capsule, then eat the organs in a capsule. If that's still not enough copper, then you're going to have to take a copper supplement. Okay. Remember, you need probably 8 milligrams, I'm guessing, 8 milligrams of copper per food, and Thorn comes in 2. You're not no, you don't need to take 4 coppers. I'm not saying that. I'm saying in everything that you're eating, you still might need a little bit of copper. I'm not sure. We'd have to get a copper level, okay? And it would be best to get an RBC copper. It's more accurate. Austin, I don't know anything about kratom. I'm sorry. I might have heard of it, but I doubt it. Oh, cheesehead. I have some information for you. So, as I'm looking this uric acid level stuff up, right? And you guys know that I love dogs. I mean, I love dogs. I love dogs. I love dogs. Yes, I do. I have one on my lap. Okay. Um, did you know that dogs can eat muscle meat without eating any organs, although I do give my dogs organ meat? Because they have an enzyme that breaks down uric acid. It's called uricase. Remember, anything that ends in ASE is an enzyme. So dogs have uricase that breaks down uric acid. So they could eat a rich diet in methionine only, all muscle meats, and never have a problem because the uricase gene that they have converts uric acid to something called allantoin, Alantoin, allantoin, which makes uric acid soluble instead of crystalline up. Amazing. Dogs have this, except one breed. What breed is that? A Dalmatian. Dalmatians do not have the uricase gene. I looked it up. Dogs are amazing. I don't just simply feed them muscle meat, although I used to, and then they really love organs. They've always eaten chicken livers, but now I get them all kinds of stuff. I'll even put not paleo, ancestral stuff. I'll open up a capsule of organs and put it on their food. Um, yeah, my dogs get extra treatment. They're probably better, healthier than I am. But I did worry. I go, "Oh my gosh, I'm feeding my dogs all this uric acid and their kidneys might not be able to get rid of it." But they can. They absolutely can. They don't usually build up uric acid because they have this gene that we don't. So they're an animal, we're an animal, and we don't have it and they do. Crazy, crazy, crazy. But no, I don't think I could have been a vet. There's absolutely no way I could put down a dog or a cat. I couldn't put down I couldn't kill. I don't know, even if they were suffering, I couldn't do it. I could not pull the trigger. I couldn't do it. I know that it could be the right thing to do. I would let somebody do it. I had to for Tucker. It was the absolute worst thing that a person like me could ever go through. Let's just say it that way. My other two dogs, they died basically in their sleep. Um, yeah, squirting nitro. So yeah, it's tough. You dog lovers out there, I know you hear me. Um, Kiazin, doc, I have persistent reflux, no specific reason. After scopes, PKD with enlarged polycystic kidney disease with enlarged kidneys with 1 centimeter sliding hiatal hernia on a keto diet helps PKD, polycystic kidneys, to slow down. Been thinking of getting surgery for the hernia. I mean, do you really need it? If it's a sliding hernia, is it causing problems? Remember, you could repair that hiatal hernia and you could still have reflux because the lower esophageal sphincter, let me try to explain for those of you who don't know what we're talking about. When we consume food, it goes in our mouth, down our esophagus, and then there's a little door at the end of the esophagus called a sphincter. It's a muscle. When we swallow, the globulus of food, the clump of food, triggers the door to open, and then the food dumps into the stomach and hits the acid and all of that. The stomach acid is somewhere between 1 and 3, and it breaks it down. If the door does not shut after the food drops in, then stomach acid can reflux back up. Is it common with a hiatal hernia? Yes, but if you have a hiatal hernia, you don't necessarily have to have reflux. If you have reflux, you don't necessarily have a hernia. So you could fix that hernia and still have a door that doesn't close, and you could have gone through surgery unreason, with for no reason, and you still have reflux when you get out of surgery. Something is making your door not close at the bottom. Could you have insulin resistant? Yes. Could you be eating peppermint or spearmint or any type of other herbs like spices that would close or relax that door? Do you smoke? That relaxes the door. Do you have slow gastric emptying so your stomach stuff contents is not dumping? Maybe you have overactive GLP. Maybe you're on a GLP medicine. Before I go in having a surgery, you have to know what is going on. Could your polycystic kidney disease be from Insulin resistance? Possibly. Could it be iodine deficiency? Possibly. Do you have a thyroid problem? Possibly. So many things, Kiazen, that you need to look into before you just go jumping into a surgery, okay? I'm not telling you that's not the right choice. I'm just saying, did you look into it? Stain Keto says, how do I feel about sweet potatoes? How do I feel about them? I have no emotional feeling towards sweet potatoes whatsoever. Do I like their taste? Love their taste. Do I eat them? Never. They grow in the ground. They grow under the ground. They are taking up all of the heavy metals I do not want in my body. The stuff in the air going down onto our ground now, maybe 30 years ago, eating a sweet potato would have been fine, or a regular potato, or a carrot. I would not touch those things that grow under the ground now. Any root plants like ginger, turmeric? No, absolutely not. I don't care if you told me it was organic. Did you raise the soil off the original soil, and did you put an umbrella over it and you watered it with reverse osmosis water? I would want to know all of that before I touched your potato. I know. It's crazy, right? I'm not that. I'm just telling you I'm not gonna eat those things on a regular basis. Do I go out to eat sometimes? Oh, let's not talk about going out to eat. I probably will not experience that again for another year. There is a reason why I do not go out to eat, and last night was a reason why. Okay. AMV says you explain things beautifully and easy to understand. Thank you. Thank you so much. Yeah, I mean, that's possible, Marla, why your ferritin can be low. It if doctors are only looking at ferritin level and telling you that you're low in iron and then give you an iron supplement that makes your iron dysregulation even worse, your iron's just misplaced. It's in the wrong spot. They're measuring the wrong place. And then they're telling you to take it, which is making your problem even worse. Worse. And they didn't check a copper level, did they? I know I'm stuck on this copper, but I really think copper is a huge thing. Insulin resistance, number one. Copper, number two. For right now. Tomorrow it might be something else that'll trip my trigger. Um, One bird, how do I get rid of the inflammation that's causing the aneurysms? Get rid of your insulin resistance. That is number one. Check your homocysteine. Can you lower homocysteine? Yes. Do you eat a diet that's increasing methionine and increasing homocysteine? Do you have MTHFR? Did you check? Maybe you don't have methylated vitamins. All you got to do is take a methylated vitamin to decrease your homocysteine, to decrease your inflammation. What inflammatory markers have you checked? There's there's rabbit holes of information, but I don't know what your inflammation is caused by, but diet is probably 75% of it, okay? And I would start with insulin. Kiazin says, I think it's mechanical, enlarged kidneys, applying intra-abdominal pressure causing reflux. So your kidneys are so big that they're pushing on your stomach and forcing. I mean, I could see a baby growing in your belly, pushing upwards, causing reflux, but big kidneys? Why do you have big kidneys? You're going to have surgery to fix a hiatal hernia when you maybe got to figure out why your kidneys are big? I know it's complicated, but maybe they just aren't looking in the right spot, Kiazin. Hopefully I'm saying your name right. Staying keto. Last food question. How about raw honey? If I was sick, which I haven't been sick since 2020, if I was sick and I had cold snifflies, I would probably take a teaspoon of local within a 5-mile radius of my house raw honey for 5 days. I would possibly do that. I'm not sure, but that's the only time I would do it. If honey is like an antibiotic, right? Especially for your area, localized. Do you take an antibiotic every single day of your life in order to prevent something? No. So why would you take pure fructose? Because you want to increase your immune system. It does not. You want to take raw honey on a daily basis that causes a fructose load on your liver, which can increase your uric acid, which can increase your risk of fatty liver. It would be just like drinking alcohol every single day. Would you drink alcohol every day? Maybe you do. Staying keto, I don't know. But for the same reason I wouldn't do alcohol, I wouldn't do any fruit, and that includes raw honey. But again, you are you and me is me, and you don't have to do what I do. I'm just telling you what are asking my opinion. So my opinion is for me only. Would I put this in my body? Absolutely not. But I have it. I have it in my cupboard. I have Manuka honey in my cupboard for a case. If honestly, if I got cut really bad and I didn't have what I have at home to take care of it, I would put raw honey on it and I would bandage it up. Okay. Manuka honey. That's what I would do. Um, Cheesehead says, why does my comment about high fructose comment keeps getting deleted? I'm just trying to explain to doctor. It's not her. She's not doing it. Cheese, Eric, there might be a key word in there that's getting blocked. I don't know what it is, but I'm sorry, but it's not Lucy. She's not deleting your comments, but it could look as if she did because she's our moderator. But it could be a key word that you're using. So if you have a question about high fructose, uh, can you help me out? Yep. So Lucy's not deleting anything, right? Okay. Right. Yep. A word can be marked and they don't like the word, so they delete the comment if it has the word. Okay. Yeah. So Lucy, you're probably getting another 2 grams of glycine in your magnesium glycinate. So now you're maybe at an 8 to 8. So you're perfect. You're neutralizing the methionine with the glycine and all of those 3 supplements that you're taking. Okay. What is the optimal level of copper? I'd have to look that up, Lucy. I'm so sorry. I'm guessing 10, 10 maybe. Um, 10 to 12 would be a good amount of copper. Is that what you said? Yeah, copper. I think 10 to 12, but I'm not sure. Okay. Please don't quote me on that. Do you know who's a very good source, a guru on copper? Would be Morley Robbins. I've always wanted to get his book. I think I'm gonna get the book. But that he's a guru on copper. Okay. And then, is it Brownstein? No, Richard, who's the fructose guy? Help me out, Lucy, the fructose guy who studies fructose and uric acid. He's a guru of fructose. Um, Richard, is it Richard? I don't think it's Brownstein because Brownstein isn't that the iodine guy? So you have all of these gurus that just completely study one thing and they get to be experts on it. And then you have to connect the dots. Like I have to read all of their stuff and then I have to connect the dots back to tell you guys not to overdose vitamin D or vitamin C. And so see what I'm the family practice doctor, I guess. I don't want to be an expert at all of these things, that's for sure. Okay. And yes, iodine is excellent for health. Most everybody is deficient in iodine. Iodine is necessary for every one of our cells. Every cell in our body needs iodine to function. Our diet is depleted of, of iodine because our soil is depleted of iodine. Plus, as I spoke about yesterday, we take in a ton of fluoride in our toothpaste, in our water. Fluoride is a halide like iodide, like bromide, like chloride. Those are in the halides, a group of chemicals on the periodic chart, the halides. And iodine gets displaced. Richard Johnson. Thank you, Lucy. Mr. Fructose is Richard Johnson. Whew. And then Brownstein is iodine. Okay. And then Robbins is copper. Okay. Good. Thank you. Um, okay, where was I? Iodine. If we are consuming a ton of fluoride in our water or in our toothpaste or fluoride treatments, we displace iodine. We need iodine for our thyroid, for especially our thyroid. We talked all day yesterday about our thyroid, okay? So if we have over fluoride in our diet, if we have bromide, we get bromide, it's a flame retardant, bromide is. It's used as a flame retardant. It's in the shirt. It's in pajamas. It's in our bedding. It's in carpet. It's in the material on your couch. If bromide is high, iodine is going to get displaced. So, RAF saying iodine is excellent for our health. It's true, it is excellent for our health, and most everybody is deficient. Okay. And you could say, but I eat iodized salt. Okay. Probably not enough iodine. And the minute you open the salt shaker, the iodine will evaporate. So if your salt shaker's it's got the little holes in it, right? And you pour it in there and then you leave the salt shaker on your table, the iodine's gone. The iodine's gone. That's why when you buy Lugel's iodine, it's in a brown bottle to protect it from the light, and you seal it. You take the drops out and they put the thing back in quickly, right? It's just like vitamin C. Vitamin C will ascorbic acid will deteriorate when it hits light and the air as well. These things are very unstable. Oh my gosh, there's so much going on in my head right now. There's so much information. What else, you guys? What else do you guys got for me? What other questions? Yes, sweet potatoes do have oxalates, a ton of them. Oxalates, phytates, any plant has oxalates and phytates. Could you boil the thing with the thing with potatoes and with sweet potatoes is that usually we don't eat them raw. We cook them, we bake them, we're baking out a lot of the oxalates and phytates, luckily. But another guru that I want you to listen to, and I don't know him personally, but I love you. You guys call me brilliant. Richard Smith. Richard Smith is is a brilliant man. He's he and Stephen Thomas. They have like a once a week little thing that goes on. And I just think that Richard Smith is brilliant. When you talk about me, being able to know if this is up and this goes down and all of that. Oh my gosh, he knows the exact pathways for everything. And I don't, you guys, nor I kind of want to, but I don't want to burden you guys with all of that information because it's going to do you no good. You just need to get the gist of it. If I tell you, please don't overdose vitamin D because you could lower vitamin A, and then vitamin A will lower copper, and then copper pushes your iron into your tissues and causes displaced iron. And then your doctor sees low iron, low hemoglobin, you're tired, you don't have oxygen to your brain, and you go, here's your iron, here's more of it, which makes everything worse. Those simple little things I can relay to you. But if you ask me the exact mechanism that this goes through to lower that, to raise that, to disturb this, I'm sorry. I'm not that brilliant. I mean, I could study it, but I just don't know that stuff off the top of my head, okay? I think Richard Smith knows a lot of that stuff off the top of his head, and he's a good resource, okay? Lucy, I will see you next week. Thank you for being here. I appreciate it. Melanie asks, are all nuts high in oxalates? Yes. Particularly almonds? Yes. Um, they just are, and high in lectins, which is another thing. They're high in cyanide, they're high in heavy metals. There's just a lot going on. You guys, before you leave, please hit the thumbs up right now. Everybody who's listening right now, if you could all just like this video right now, like it, hit the thumbs up or the hearts or whatever, and that will help everything go stronger, whatever, okay? So that does help. Melanie, you have to decide whether or not you want to eat, nuts or not. Again, there's no nutritional value because of all of the anti-nutrients, okay? All of the anti-nutrients that are in it. Plus, nuts are usually roasted with um they're roasted with seed oils. Unless you get baked nuts. Now, baked nuts are going to be better than roasted nuts because roasted nuts use sunflower oil or palm kernel oil, but seed oils in order to cook them. Whereas a baked nut is basically baked. You never, ever, ever, never want to eat a raw nut. Never eat raw nuts. Even if they tell you they're the most awesome things in the world, don't do it. And if you want to eat an almond, just peel it. You could peel all of the brown off of it. I don't want any nuts after that. That would be miserable having to peel it. Tanya, thank you for giving me the likes and at least hit 150 hearts. See you later. Thank you. Thank you, Tanya. I appreciate that. Okay. Anything else, you guys? I want to, while I'm waiting, if there's any other questions, I do want to thank you all for being here yesterday with me. If you were here yesterday or you caught the replay of it, I just want to thank you for um just for sharing my birthday with me, and that it was nice. That was the best part of my day. I even tried to watch softball and couldn't enjoy it. They're just not my teams. But today will be better. Um One bird, I think I went over your question on the inflammation. So maybe look that over, okay? Why can't we eat raw nuts? Good, because they're high in heavy metals, very high in cyanide and arsenic, and very high in lectins. So none of it is cooked out. You definitely want to cook your nuts, not your nuts. I don't know if you're, yeah, you know what I'm saying. But anyway, edible nuts need to be cooked. Roasted is not quite as good as baked, but again, try to avoid them. Or you do what you want to do. I try to avoid them. Okay. All right. Make sure there's no other questions. Does not look like there is. Raw fruits. Birdie, you have to decide whether or not now Melanie's either laughing at you or she's laughing at me and she's giving me the one eyebrow up. This. Like, what you talk about, Willis? Right? Um, Raw fruits. I personally do not eat fruit because of the fructose, which destroys my liver. That's where I stand on fruits. But again, you have to decide. They're very high in sugar. Remember, a fruit is fructose and glucose, so you are going to get a spike of insulin. Fructose goes directly through the liver. It damages the liver. It doesn't go through the glycolysis, the breakdown of the glucose chain. It does not go through that. It doesn't have a chain. It goes straight to the liver for breakdown. So the liver is going to be taxed breaking down fructose. Remember, fructose is like alcohol. Whether you drink alcohol or you eat fructose, your liver is going to be taking care of that toxin, just like it's taking care of any other toxin, but especially alcohol comes first. Okay? Alcohol comes first. Fructose is like alcohol, it comes first. Every other job by the liver comes second. Um, Diddy says, late to the show. That's fine. I'm just glad you're here. I was told a handful of almonds and walnuts a day. Good fats like avocado, just not a lot. So, what did I miss? We were talking about nuts that are high in lectins and that are high in oxalates. They grow in the ground, same as an avocado, which grows on a plant. But you're being taught that nuts are a good source of omega 3. Any plant does not have omega 3, it has ALA. And then you rely on your body to convert ALA to DHA and EPA. Okay. Nuts have toxins. Their coating is full of toxins. They grow in the ground. They are toxic. They have heavy metals. Like a handful of almonds might put your arsenic level overdose. Okay. It's up to you. And yes, birdie cooking lessens it tremendously. Are citrus fruits any better on the liver? Well, it depends on what the problem is for the liver, you know, but fructose is fructose. We use, like I told you, we use a citrus fruit like lemon. We use lemon to help the kidneys detox from uric acid. Okay. So it's not like they don't have a place, but it's not something that you would want to do on a regular basis. I'm guessing. I don't know. Okay. All right. Sass asks, what do you do for DHT? Sass, are you male or female? And that would help me. That would help me. But let's just say Sass is, let's say Sass is female. Let's just go with that for a minute. Okay, 65-year-old female. Okay. When women become um, menopausal, postmenopausal, they lose estrogen and their androgens build up. Our body naturally let's just take for instance in the your ovaries aren't working. So we're going to talk about the adrenal glands. In the adrenal glands, DHEA converts to androstenedione, and androstenedione converts to testosterone. And in a perfect situation, testosterone will convert to the estrogens, E1, E2, E3. Okay. But in a postmenopausal female, testosterone converts to DHT instead of estrogens. And so, how can we lower conversion of testosterone to DHT? One, you surely do not want to be insulin resistant. That will hurt. But DHT, to block it, if we're talking about hair, we want to block it on our scalp. The sebum that's on our scalp holds DHT. So you want to make sure you have a shampoo that has like salicylic acid that helps strip the sebum and clean the debris from your scalp. Our scalp ages faster than our skin on our face. So at 65, your scalp skin is older than your face skin, even though your face takes a beating. But it's from things like the sebum and the buildup of debris. And it could be thick or it might not be thick. Some people have symptoms like seborrhea, like dandruff. Others don't, but they still have sebum built up. And so they will get thinning hair. And if they start going on, remember, hair grows slowly after menopause too. So you're looking at a year of trying to grow hair. But if you have sebum on your scalp, that's going to suck in and hold all of your DHT. So you want to make sure the sebum is clean from the scalp. So you can do that with a salicylic shampoo. Something like nioxin is a good source of salicylic acid for your scalp. I'm sure there's serum, salicylic serum that you can apply. And then maybe just washing every 3 days or so. Okay. Maybe you don't necessarily need to do it every day, but you don't want to do it once a week. Although some people do, and they don't have a sebum problem, and then others do, and they do have a sebum problem. Another thing blocking DHT is stuff like pygeum or saw palmetto or oh, I'd have to look it up. There's other things like natural herbs that block I can't think right now. There's other herbs or other supplements that do block um DHT. Then to kind of compound for hair growth, you want to make sure you have supplements that have biotin in them. But just taking biotin is not going to cause hair growth if you have too much DHT. Makes sense? So hopefully this helps a little bit, Sass. I'm not completely well versed on this, but I just maybe know enough that I could guide you in the right direction. But you almost have to hit it from three angles, okay? You want to give yourself the right nutrients that help hair and nail growth, like the collagen, like the Paleo Valley bone broth powder stuff, okay? Then biotin and some other things that help hair and nail growth, okay? Collagen's gonna be a big one. Collagen for elastin and all of that. Then then blocking the DHT itself, then cleaning the scalp on a regular basis from of the DHT, which is the sebum. Three different ways. Three compounding ways to help with your hair. Okay? Sasa, that's a good one. Okay. All right. I think that's it. Is that it, you guys? There's some just joining in, and I apologize. We are live every weekend, every Saturday at 9 a.m. Central and every Sunday at 10 a.m. Central. Bring your questions and just sit back and listen. I usually present a topic. Yesterday we talked about thyroid. Today, per request, they wanted to hear about uric acid and gout. And if you want to go back, re-listen to this whole live stream, because the first hour was talking about high uric acid and why, and yeah, and a whole bunch of other stuff in between. It was a good talk. I tried to keep it understandable, but again, these are topics that will probably need to be revisited to get a good grasp on it, even for me. Okay, so it's going to take a lot of over and over and over education and talking about it, and that's what we do. I'm going to try to do reels on the weekend to talk about it. Maybe I talk a little bit about uric acid this weekend or this week in my reels. It's possible. Hey, Jack, thanks for being here. I appreciate it. And yeah, well, I'll see you next week. Thank you. Sasa, thank you for the gift. I appreciate that as well. So that helps the channel, you guys, when you give super stickers and super chats and subscribe and do all that. It helps me. I'm not being paid for this. This is my job now. I do consults with you guys. So for those of you who want to go over your numbers personally, um, you can email me at ironladydoc@aol.com. ironladydoc, and at AOL. And you can sign up for a consultation. It might be worth it, a one-time deal that you go over we go over your labs and just see where you're at. I mean, if you think this is complicated, sometimes I pull some things out of your labs that your doctor never saw, and you go, "Oh my gosh, that's eye-opening. Thank you." It does help. And that's what I do. I do all my appointments now are online. I do not accept insurance, so it is cash pay. And Bertie, you're very welcome. So I appreciate you for being here. What's your name on YouTube? It's Iron Lady Doc, just like on Instagram. So AMV, if you could go over there and like my stuff. Sometimes on YouTube, you have to do Iron Lady Doc Malia Jensen, and then it'll pull me up because I don't know, you know how the algorithms work, but if you just pull up Iron Lady Doc, sometimes it'll go to Margaret Thatcher, and I'm nothing like her. And she was not a doctor, but she was surely an Iron Lady, that's for sure. So Iron Lady Doc on YouTube, Malia Jensen. Okay. And you're very welcome, Birdie. And then, yeah, hit the likes and the subscribes over there too. Okay. Yeah, thank you, Sasa. I appreciate it. Okay. So we'll call it quits today. We'll be back, Lord willing. We'll be back next Saturday. And we're going to end. Sometimes I think we should end on this Bible verse every single time we have one of these live streams, but it's from First Thessalonians 5, verses 21 and 22. And the reason why this verse means something to me is you guys always ask, how do we know who's telling us the truth? You tell us one thing, somebody else tells us another thing. Who do we believe? I get it. I get it. I used to be 300, well, 180 degrees the opposite of what I am right now. Yes, and well, First Thessalonians 5:21 and 22, it says, test everything. I mean, test everything. Examine everything carefully. Hold fast to that which is good and abstain from that which is evil. I say this to myself all the time. How do I know this is true? The Bible tells me, hold fast, test everything. Test everything carefully, examine everything. Don't just take people's word for it. Even mine, do not take my word for it. Look it up, okay? Look it up so I know. You look it up so you know. Tack, it doesn't work like that when you just say donation $10. I'm sorry, but you have to actually put it in a super chat or a super sticker. So, but I appreciate your willingness. So test everything carefully, examine everything carefully, and hold fast to that which is good. The good is the Jesus part. None of us are good. He is the description of good, Jesus. And abstain from that which is evil. So abstain from Satan, abstain from the father of lies. That's test everything, okay? Examine everything. Hold fast to Jesus, Bible, and abstain from the father of lies whispering in your ears. So you should get a gut feeling if something is not right, okay? Like, honestly, now by now you should know that if you eat a bunch of ribeye steaks full of saturated fat, that it is impossible for it to go down this tube and then get into the heart without being broken down and clog up your arteries. It's impossible. I can't believe I even was gullible enough to believe that, but it doesn't matter at this point, okay? It doesn't matter. What matters is me moving forward and teaching you guys how heart attacks occur. They don't just occur out of thin air. They don't occur just because you have high LDL or just because you have high LP little a or ApoB or whatever it is. There has to be an injury to make something damage it further, okay? Or else we would not have a population. There would be no such thing because one out of two people have high, according to them, LDL or high LP little a. Everybody thinks they are doomed to a death sentence with an LP little a. Everybody has LP little a. Everybody has LP little a. Just how much do you have? And is it going to be a problem? It will be if you have an insulin resistance. It will be if you have iron overload. It will be if you smoke or drink or smell the air of heavy metals. You're around diesel fumes. If you don't sleep, it could be a problem. If you're stressed out, it could be a problem. All of these things can be a problem, but the there has to be some sort of a nidus, okay? All right. I think you guys understand. And if not, we'll get it. And if you say, okay, Dr. Johnson, then what should I be doing if this is this and this is that? And then we can talk about it. And a lot of times I go over all of this in our consultations, but it's not medical advice, you guys. It's for information purposes only. It's for you to open up your brain and start thinking about other possibilities of what's going on, okay? That's what this is about. Um, Fiaza, see, this is perfect, and I'm not going to make fun of Fiaza, but this is perfect on the indoctrination and the propaganda we've been dealt with for the last 30 or 40 years. Fiaza says, what if stents are placed already? Okay. Had blockages, put in stents. Should a person eat less fat to lower LDL? Or what should be done? What type of LDL do you have? If you have large, fluffy LDLs, that was not your problem. You did not get blockages because you had light, fluffy LDLs, Fiaza. You got blockages because you were insulin resistant, eating a bunch of carbs with high sugar, that caused high insulin, and high insulin is an inflammation along with the sugar, and then you might have not exercised, you might have been obese, you might have not been sleeping well, you might have been at a job that you didn't like, and you were stressed every day driving to work. All of those things. You don't just have an LDL problem, you have a lifestyle problem. And that lifestyle made your LDLs shrink and shrivel up and turn to small, dense LDLs. And you mix those small, dense, sticky LDLs with an injury, and then you have a blood clot problem. You just caused a soft plaque. And then the soft plaque hardened just on the cap. So Fiasa is telling us they got type 1 diabetes. And with type 1 diabetes, all that tells us is Fiasa doesn't have their own insulin, so they have to inject insulin. But you only need as much insulin as you take in of carbs. If you take in a lot of carbs, you need a lot of insulin. If a normal person like me eats a lot of carbs, you're going to need more insulin. That spike of glucose, that spike of insulin is a problem. It increases my risk and your risk of having a heart attack. It's the number one cause of heart attacks is type 1 diabetes or type 2 diabetes or insulin spikes or sugar spikes. It's all the same. Whether you're dosing your own diabetes or your pancreas is dosing its own diabetes, it or insulin, it's the exact same thing. It's insulin. Too much insulin, hyperinsulinemia. So if you want to eat your bread and your pastas and your cereals, then you're going to need that much insulin to cover it, right? And that is our problem. You don't eat those things, you need less insulin. You need 4 units instead of 100 units. I made that up. You need 4 units instead of 25 units. Makes sense? Um, yeah, that diabetes was your cause of your injury to the lining of your arteries requiring a stent. Okay? Over time, that stent is going to become enmeshed into your natural artery. But the LDL is not the problem, it's the injury. And the tips of your stent are where the injuries are going to occur at the tips, at the ends of the straw. That is the most dangerous aspect. If it doesn't start there, it's going to start somewhere else. And insulin is the primary nice. And then if you do anything else like smoke, drink, smell diesel fumes, eat heavy metals, all of the things we've talked about, don't sleep, don't exercise, have high stress, all of those things, okay? Those become a problem. So Phasa, I'm sorry that you have this condition. I'm sorry you have to dose your insulin. You were born like that. Um, but it's really, you're probably an expert at dosing your own insulin and you're a pro at it. You're just like your own little pancreas with a push of a thumb clicker. And that's awesome. But you don't have to click the button so many times if you don't eat the foods that need the insulin. Okay. And that was probably, but you can move forward from here on out, move forward, and you need less and less insulin because you eat less and less crapola. Okay. You eat less crapola. How can you watch yesterday's thyroid discussion? You can either watch the whole thing done on YouTube at Iron Lady Docs. I don't know if you're over there, but you can go to, like, if you go to my channel after we're done, and then you know how there's a you know, the all the little squares, all the little squares are all my reels and all of my stuff, all of my live streams. And so all of the reels will have a label on them. All of the live streams every Saturday and Sunday, there'll be 2 in a row, and they will have just me without a little label at the bottom. Like my reels will say what my talk is about. And my live streams, I don't put a label on them. They're just because there's so many topics. So they're just all one. So does that answer? So when we're done, Dawn, you just go to all of my little squares. I got my little buddy here. You guys, I'd like to introduce you to somebody. This is my birthday present. Yeah, I adopted him. Mm, his name is Buddy. I call him Buddy Boy. So my little BB. Okay. And yeah, he's 2 and he got rescued from, sorry, I'm crying. I'm just so happy. Um from rescue rehab and rehome. Okay. And that's why I feel so much toward that fundraiser, you guys. Um so yeah, him and Talo came from Norman, Oklahoma, and he was a surrender. You eaten my tears. Okay, he was an owner surrender, and I think he's pretty healthy. It's okay. Talo's over there whining because he hears me. He knows. So this is Buddy Boy, my little BB. Okay, and so yeah, he's become my lap dog in the last 24 hours. He's a definite lover. So yeah, that's why I do live fundraiser for rescue, rehab, and rehome. And by the end of May, I my goal was $100, and I've went over that at 155.69, $155.69. So my goal as of yesterday was $200. And yeah, Summer, I know he is an empath. So yeah, thank you. Um, yeah. So he's precious. Thank you, Sasa. Anyway, Lord willing, he and I will be back. Tucker, I blame this on Tucker. He says, "Listen, Mama, I know I was your soul dog, but you got to give your love to all of these other dogs, right?" So my little co-host from heaven, Tucker, is saying, "It's okay. You needed a birthday present." And I asked for a birthday present last year and I didn't get it. So this year, it just happened that it was on the day and it was magical. So yeah, that was the best part, is a birthday present. Okay. Okay. So tomorrow, this week, watch for my reels on, maybe we'll do uric acid again. And then next week, Lord willing, next Saturday, we'll come up with a new topic. And so every Saturday at 9 a.m. Central, every Sunday at 10 a.m. Central, sign up for a consult if you'd like. Okay. All right, you guys, have a most beautiful Sunday, a blessed Sunday. We'll see ya. Oops, there we